Welcome to the Crisis Response Podcast. In this episode, we are joined by Jake Gillanders, the Executive Director of Empact Northwest, which is an international disaster preparedness and response organization based in Washington State. Welcome to the show, Jake. It's really great to have you.
Hey, thanks, Jason. I really appreciate being on.
Absolutely. So the timeliness of this conversation couldn't be more relevant. I mean, you guys are in the middle of a big deployment. Could you tell us a little bit about what's going on right now?
Yeah, you're absolutely right as far as timing. I think our team is probably touching down literally right now or any minute now in Adana in Turkey. So they're transiting. They've just left Istanbul a few hours ago, and they're transiting into Adana where they're going to touch down and start going to work. And this initial team it's what we call a Pathfinders team. It's really all about establishing the mission for the follow-on team. So their job is to be light and fast and agile and figure out where the needs are the greatest. You know, our organization is really dedicated to serving the underserved. So when all of the large teams, whether it's search and rescue or medical or relief, are focused on the big population centers, we work on the outskirts and we find the areas that aren't getting that relief. So their job really is to figure out where those spots are so that we've got good actionable intelligence for our follow-on teams and our partners. And we've actually got our follow-on team leaving in about probably 24 hours from now. So that gives these guys a little bit of a head start to figure out what's what and who's who. And then our next team can get in and get right to work.
That's amazing. Really fantastic work that you guys do. And we, Trek Medics, we've known you since January 2010, I believe. The Haiti earthquake was the first time we ever came in contact, and we've been friends and collaborators ever since. I'm wondering if you could share with our audience, how does this work? How does Empact Northwest decide where to go, when to go? What's that process look like?
Well, I wish I could say it was the same every time, but it's not. You know, we evaluate every disaster, every event as its own event because it really is, and everyone is a little bit different. So generally, though, we respond at the request of either a host agency or a partner NGO who's already active in the area, or a host government. We have relationships with governments around the world. We have relationships with NGOs around the world, and we'll typically respond and request to that. Now, some events like this one are of such a significant scale that it's sort of an all call. And when it comes down to that sort of model, we're part of an organization called INSARAG, which is the International Search and Rescue Advisory Group, which is part of the UN OCHA. And national governments can put out requests for any USAR, urban search and rescue, or medical response teams through that. And that's how this deployment specifically started, is there was essentially an all call from the government of Turkey of send us whoever you can and whoever you have. So all of us registered entities within that INSARAG structure received a request for deployment. And so that's how we got out the door on this one. So it's really a variable model. It depends on where the disaster is and what the disaster is and the nature of the disaster. You know, one of the unique things about our organization is we don't really pigeonhole ourselves into any one kind of disaster. We do earthquakes, we do pandemics and epidemics, we do conflict medicine and conflict relief for civilian populations. There's really nothing we won't get into if we've got the personnel to support it.
And what kind of personnel do you staff? I mean, what type of responders are you bringing along with?
Yeah, so when we respond, we've got three units really. We've got a rescue unit, we've got a medical unit, we've got a logistics unit, and each one of those has subspecialties within it. So our rescue unit is made up of really highly qualified and experienced urban search and rescue professionals. Most of them are active on U.S.-based technical rescue or urban search and rescue teams. We've got technical search specialists who manage the cameras and the seismics and the acoustics and drones, and then we've got canine search and rescue providers. So we actually have a team of 4 search dogs right now. All of our dogs are live find. We don't do any human remains work, but we've got that component to the rescue. Our medical team is made up of experienced emergency medical providers. So that looks like everything from an EMT to emergency room physicians and kind of everything in between. I would say the bulk of them, though, are nurses, paramedics, and emergency room docs. And then our logistics team is really, they're the ones who, they kind of make everything work. And we've got folks from all different backgrounds in there. I mean, we've got literally our logistics unit leader is a flight attendant in her day job. We've got an acupuncturist in that unit. And those are the folks who may not have a lot of emergency background in their regular civilian job, but who bring a strong skill set to the table in doing the relief work. And like I said, just making things happen.
Clearly a huge need for all sorts of professionals. So in this case, in Turkey, the all call goes out through Insarag, which, for our listeners is really important, I think, to let them understand that this isn't you're not freelancing here and just showing up, but rather there is a process that you're following. And the call goes out, you answer the call, and then what happens? Do you start getting on the phone and calling up people or sending out emails? How do you figure out who's available? Because this is very last minute stuff, to say the least.
Yeah, absolutely. Our key window, especially for rescue, is generally 24 to 72 hours. Usually, local resources manage pretty well for the first 24 hours of an event, but at that 24-hour mark, they start to get burned out, and you just start to burn through what you have available locally. But the large teams that you see, the large international teams, a lot of times can take up to 72 hours to deploy. So we really try to exist in that 24 to 72-hour window. We're a little bit heavier than a local response, but not quite as big as the big USAID teams or the international government sponsored teams. So time really is of the essence. And we use a couple pieces of technology to reach out to our team. We've got a good network, but we use, like I said, we use technology to reach out to them, and they're able to report back to us their availability, so that our operations team here in the States can quickly make those decisions and build out those teams. And we'll generally have a good idea of whether or not it's going to be a rescue deployment, a medical deployment, or a relief deployment. And that will steer us. So, for instance, Turkey, simply because of the travel and the geography, this was not going to be a rescue deployment for us. By the time we put a team on the ground, the rescue problem was going to be over. So that was going to be addressed really by the local teams from Europe that were able to respond very quickly. So it became immediately apparent that in the time frame that we would be able to get on the ground, this was going to be a medical mission folding into a relief mission over time. And so, we look at what the mission is, we determine what the most appropriate resources for us to send are, and then we reach out to our team through those pieces of technology and get them moving.
You probably have a pretty big inventory of supplies that you keep, on the ready. I'm wondering if you could share a little more about that inventory. What kind of supplies do you stock, and what do you bring along, and what do you rely on getting when you arrive in country?
Yeah, we really pride ourselves on being self-sufficient for the first 7 days of any deployment. So we're fully self-sufficient: food, water, shelter, sanitation for the first 72 hours. After that, we need access to water and to fuel. But other than those things, we maintain self-sufficiency for 7 days. So that means we take everything with us. We take our own shelter with us. We take our own food with us. We take our own sanitation supplies, and I'm trying to think what the right term is. Essentially, portable toilets to make sure that we're not making more of a problem than we're solving. And we keep all of that stuff, like you mentioned, ready to go, because we do have such a quick turnaround time as an organization that we just don't have time to gather those things up. So we have a storage unit. We run very lean. We don't have a warehouse or anything fancy like that, but we have a couple storage units where we keep all of those things packed up in bags, ready to go and head out the door. So typically one of our logistics members goes, there's, one bag for every 4 people. So based on the team size, they grab however many appropriate bags, and out the door we go. Now, that being said, we do try to keep our loadout pretty light, because one of the things that makes us unique in this world, especially in the USAR environment, is our flexibility. Part of our mantra as an organization is that no job is beneath us. No job is too hard. No job is too small. So whatever we are needed to do, we'll do. And so we try to keep, like I said, our loadout very light so that we can be flexible. We try to stay as man packable as we can, or person packable as we can, whenever we can. And so the rescue equipment and rescue tools that we deploy with tend to be light tools, hand tools, that sort of stuff. Anything heavier than that we'll generally source in country.
Really impressive that you're that sustaining, and that you have quite a bit of experience, I'm sure, has fed into this.
Yeah, it's been a learning curve, to say the least.
For sure. Absolutely. So the team arrives on the ground. They're in the affected zone, but as we know from the reports, first there was one earthquake. I think it was, my numbers are probably wrong here, but it was 7.5, and then there was another earthquake that was 7.0, or something to that effect. So the affected zone is quite large. How does your team decide where to go? And then when they get there, how do they know what they're supposed to be doing?
Yeah, so there's a couple ways that this works. The first model is again if we work with a partner NGO or a host government. Typically, the partner NGO will have that ground truth for us, and they'll be able to steer us in the direction of greatest need and make those connections. If it's a government entity that's requesting us, we work for the government entity at that point, the what we call the LEMA, Local Emergency Management Authority, and they give us direction. And we very often will fold into their command structure, and they help us figure out where they're needed. The next kind of scale of that is that INSAROG model. So if it's a full-scale INSAROG coordinated mission, there will be a single reception and departure center at the airport, and we'll check in there generally at the airport. We'll check in there. We'll advise of our capabilities, and before we deploy, we've already filled that information out. So they have a roster of people who are coming in, and they already have some idea of our capabilities and the size of our team, and they'll deploy us out from there. Now, those are sort of best case scenarios, right? And my understanding, I'm not on the ground in Turkey, but my understanding is that this has totally overwhelmed all of those systems. This is, as well prepared and as capable as INSAROG is, you can quickly, as you can imagine, outpace the capabilities of any organizational structure to respond to a disaster of this scale. And so right now, my understanding is that there's very little coordination happening on the ground. And that's why we send in a light team first. So our first team will generally be 2 to 4 people so that we don't flood with 8 to 10 people standing around figuring out what to do. And with a small team of 2 to 4, they can very quickly move throughout the community. They can very quickly move throughout the region, and they can figure out exactly where the need is. And sometimes that looks like just knocking on doors and asking questions. Sometimes it's the military we're liaising with. Sometimes it's law enforcement we're liaising with, or local fire authority. Every country is a little bit different. Every structure is a little bit different. And so I know it sounds like I'm being vague, but it's just about flexibility, and that's how this mission works.
Absolutely. And you never really know what you're walking into until you get there. And even then, very dynamic situations where things can change quickly.
Yeah,
How
I don't like to relate disaster work to war, but there's a great quote out there. I'm sure somebody knows who said it, but the idea that the best laid plans exist until the first round is fired, right? And it's very similar to this. We can make all the plans in the world, but once we're in country, we find out if those plans are actually going to work.
I think it was Mike Tyson who said everybody's got a plan until they get punched in the face.
That's
That was
perfect.
smart.
I like that one even better.
So let's step back a little bit, if we may. Like I said earlier, we first met you in Haiti in January of 2010 after the earthquake. As I understand it, and maybe I'm wrong here, if I am, please correct me, but that was Empact's first deployment? Or what is the backstory? How did Empact Northwest get started? And a little bit about your path since then, because it's been, more than 10 years now.
Yeah, that's the genesis of our organization. None of us had any intention of getting involved in nonprofit work or NGOs. What happened was the earthquake in Haiti occurred, and all of us, kind of in a loose network of local firefighters and paramedics here in the Seattle area, we're all trying to find ways to get to Haiti and do good work. We were all impacted or affected one way or the other, and we were all reaching out to existing NGOs and existing nonprofit entities to try and find a way to get there and do work. And nobody was taking paramedics at the time. Nobody was interested in our skill set. They only wanted nurses. They only wanted physicians. I had one interesting experience, and I was a 10-year paramedic at the time. I've got a bit more time now, but I had 10 years on the job then, and I called an organization and I was looking for opportunities to deploy. And her response was, "Well, I don't know what to do with a paramedic, but I guess you could take blood pressures." And I knew right in that moment that she didn't understand the skill set of a paramedic. And so, all of us were having this similar experience, and we just sort of made connections by telephone. Hey, what are you doing? Hey, what are you doing? And none of us were having any success. And not knowing any better at the time, we thought, well, we can start our own organization. I mean, how hard can it be, right? We'll bootstrap this thing, and we'll just do a small mission, and the 5 of us will get the opportunity to go down there. And then that sort of quickly snowballed because lo and behold, there were a lot of emergency responders and emergency care providers in the Seattle area who were looking to do the same thing. And we're having the same outcome. And they found out about what we were doing, and they started asking if they could go. And we decided if we were going to be sending people, we should probably figure out insurance. We should probably figure out funding. So we, set up just a framework of an organization here in the Seattle area through the Washington State Secretary of State, established ourselves as an entity with no intention of growing or going anywhere, just making sure that we were all protected if somebody got hurt, on sort of this ragtag volunteer, let's go out the door kind of thing. And then we got to Haiti, and the need was just so incredible that once you see something, sometimes it's really hard to look away, and it snowballed from there. We started sending more teams, and before you know it, within that first year, we had deployed over 150 teams of providers and had provided emergency and primary care to over 15,000 people. Just kind of frankly, without any intention of getting there. But there was just such a great need. And, you may remember this, Jason, that during the Haiti earthquake, the main medical education facility in all of Haiti collapsed and took with it a whole generation of providers, nurses, physicians or physician trainees, nurse trainees, lab techs. All of those positions were trained in this one school, and they lost the vast majority of them. And they lost the vast majority of their instructional staff. So not only did they have this impact of this major disaster, but they had the huge impact after the fact of no next generation of healthcare providers. Now it left a huge gap in the primary care setting. And we found ourselves very quickly being adapted into that primary care setting. At the same time, while we were there, we discovered that, as you can imagine, Haiti had no effective emergency care program. They had no ambulance system to speak of, certainly nothing we would recognize here in the States as an ambulance service. And we had all of these young translators who were looking for employment opportunities, but whose whole world had been rocked by this earthquake. They had lost, frankly, their future. Their employment plans had collapsed with the buildings around them. And we saw this great opportunity to use our skill set in a really unique way, provide employment opportunities for these young men and women, and help improve the healthcare system of a developing nation that had been absolutely decimated by this disaster. And so, once again, you'll see this kind of the byline of our organization is why not, right? Like, how hard can it be? So we decided we would start Haiti's first ever EMT training program. Now, the other byline that runs through our history is, if we had known what we were getting into in a lot of these things, I don't know that we would have done it. But we figured, how tough can it be? And so we actually took a U.S.-based curriculum. We approached the Haitian Ministry of Health with it, and they adopted our program. They allowed us to translate it into French, and we began teaching EMT courses. And we actually graduated Haiti's first ever EMT class the year after the disaster, after the earthquake. So it just sort of grew from there. 2011, there was a tsunami in Japan, as you know, an earthquake and tsunami. And here we were with all of this experience coming out of Haiti. And we thought, well, we better go do this one too, and see if we can't do some help. And what we discovered there was that there was a great medical response system, but there was an awful urban search and rescue response system in the world. And being firefighters and paramedics, we were well positioned to fill that niche. So we were very fortunate to get a grant from one of the local native tribes here in Washington State to start that program. And we just sort of been off to the races ever since then. Everything sort of snowballed one after the other. We eventually got into training firefighters and rescue because we realized that we were developing all of this experience overseas that was, couldn't be matched with anything our local firefighters were getting. So we wanted to share that knowledge. And pretty soon people started taking notice of our abilities to develop systems and courses. And we started getting approached by developing nations to help them improve their response systems. And well, one thing's just sort of led to another. I wish I was some brilliant business mind who could say that I laid this all out in a business plan, and this was all planned from the beginning. But it's really just sort of been about being flexible and agile and seizing opportunities when they arise, and seizing opportunities to do good around the world. And I think that's been a really important part of our organization. Is at the end of the day, we're always driven by helping others and serving others. So we've seen opportunities to serve, and we've just seized them as they've come along. And we've just sort of grown and morphed into what we are today.
It always strikes me about the number of organizations that got their start, so to speak, responding to the Haiti earthquake, and to this day are growing and thriving and just becoming really big organizations. I mean, Empact Northwest is certainly one of them. Team Rubicon comes to mind. A couple others that have just, really, really taken to the mission and run with it. How many deployments has Empact had since that first one?
I've frankly lost count. I need to sit down and look at it again, but we're north of 30 at this point, not counting individual medical missions in Haiti. If we were to include those, like I said, we had I mean, we've got over 100 easily, or multiples of hundreds if we count individual missions. But I believe we're north of 30 total deployments. You're
So
right, though. It's you brought this up, so I'm gonna jump on it. The Haiti earthquake was a real revolution in the international NGO community. I'm not going to name names, but the response from the largest established NGOs was so disappointing, and their ineffectiveness in Haiti was so profound that it led to this revolution in the NGO community where we saw a lot of these small NGOs fill in those gaps, step up to fill those gaps, and it kind of created this whole sea change in the NGO community where it's not just the large organizations that are doing these things. They still serve valuable roles in this world, but the small NGOs a lot of times are the ones getting the work done. And Haiti really pointed out to the world the capabilities of small NGOs and the importance of small NGOs. We have flexibility that those large organizations lack, and we haven't. And different NGOs have gone different directions. Obviously, Team Rubicon is a huge player now, but a lot of us have by design stayed small because that small size breeds flexibility and agility that allows us to get in where the work is really needed most and do that good work at a local level. So Haiti is a huge pivot point for the NGO community. I think everything in the disaster response world is sort of, before Haiti and after Haiti.
yeah, I think that is a pretty fair generalization, though obviously it is a generalization.
Of course.
I would also say one of the things that I've noticed being among the small NGOs is the willingness to partner. A lot of the larger ones, like you said, they do a great job. They certainly fill a role, but they're not necessarily open to partnerships. And, this kind of brings me to really our collaboration most recently in Belize that I'd love for you to talk a little bit about. And maybe you could talk about this too. Obviously, the disaster response sector is difficult in terms of sustaining an organization because you have to have these stockpiles that you keep and you have to be ready to go, but these disasters are completely unpredictable. So that makes it difficult to plan. And I know, just from our conversations and our interactions and collaborations that this has kind of led Empact to get involved in other areas, particularly in more long-term development. So could you tell us a little bit about your involvement in Belize and how that all came about?
Yeah, absolutely. So, I'll start with you're absolutely right. It's hard to plan for disasters. It's hard to be just a response organization. But in addition to that, lives get saved in preparedness, right? More lives are saved in preparing communities for disasters than responding to disasters. And if I may sound capitalistic for a moment, they're saved much more cheaply as well. Your dollar can go a lot further in the preparedness section than it does in the response section. And there was a Harvard Business Review article some time ago, and I can't remember the exact numbers, but it was pretty profound. It was almost a 10x multiplier of the money spent in preparedness to save a single life versus the money spent in response to save a single life. Now, how they quantify that, I don't know. They're economists smarter than me, but they were able to put a dollar amount on it. Like I said, it was almost a 10x multiplier from one to the other. So it became evident fairly quickly that if we wanted to have a significant impact on lives saved, that was going to be done in the preparedness and training environment. Now, like I mentioned earlier, we got involved in firefighter training here locally. I believe it was 2016. We were just talking about this the other day. I can't remember what year we actually did our first course, but we got started in that because we recognized that we were developing this experience that was really, really tough to get anywhere else, and it felt, frankly, so selfish of us to just silo that information to ourselves. So we started in the preparedness space by just teaching local classes here in the Seattle area. And we do that to this day. We actually have a rope rescue course going today. So that was kind of our first foray into this preparedness environment. But then as we started deploying to more disasters and we started building our training chops here in the Seattle area, we started recognizing that a lot of these communities we were deploying to in disasters lacked they lacked an effective emergency management or emergency preparedness system. And so they were left really scrambling when a disaster did occur. And we noticed this was the case even in disaster prone regions. We made a very good hire a few years ago. Originally, we hired him as our grants manager, but he really had an eye for the community preparedness mission, and he's really driven us forward on this model. And he has forced me to reevaluate our mission several times over, and I value him very highly for it. but he's really pushed us into this preparedness space. And so he approached me originally with a mission, a program in Malaysia. I'm sorry, Indonesia was the original model. So he had done some networking in Indonesia with some contacts of his, and he had established that there was a real need there for some emergency management development. But that was in 2019. And we had an initial trip set up for early 2020. And then, as we all know, the pandemic occurred, right? And so that changed the travel model, particularly to Asia, literally overnight. And it became very quickly apparent that a program in Indonesia was going to be very difficult for us to manage. And it forced us to reevaluate whether or not that was something we'd be able to do. And so we put this idea of doing a community preparedness and emergency management development program kind of on the back burner while we were in COVID. And then in addition to that, we responded to COVID here locally as well, using our medical resources. And we helped provide surge staffing and testing and that sort of thing. So COVID sort of fades into the background, but not in Indonesia. Travel was still heavily restricted in Indonesia, and this had forced us to reevaluate just the logistics in general of trying to manage a program across language barriers and across such a significant geographic distance. Meanwhile, this same guy had gone on vacation in Belize, and he started talking to some folks down there, and very quickly realized that what we understood to be the ground truth in Belize was not the truth, that there was a very anemic emergency response system. The fire service there was totally underdeveloped and underfunded. And despite their best efforts, they were really, really challenged with some limitations. And the emergency management system was even more underdeveloped or more anemic. And so it quickly became apparent that there was a need there. And so he took this idea that he had developed through Indonesia, through the Indonesia program, and he said, well, "Why don't we apply this to Belize? You know, there's no language barrier because English is the primary language. There's a clear need, and logistically, it's much simpler to get from Seattle to Belize than it is to get from Seattle to Indonesia." And so we were sort of off to the races. I paid for him to fly down there on a trip and have some meetings. There very quickly established a need, very quickly established an interest from the Belize National Fire Service and NEMO, which is their National Emergency Management Organization. And it just sort of, once again, it snowballed from there. So now we're very heavily engaged in Belize in several ways. We're helping them develop an incident command system based on the US ICS model. We're helping them develop a rescue response capability. So I'll be flying down there here at the end of February to start working on the next phase of actual hands-on rescue training. And then we're working with Trek Medics for one of the pieces I'm most excited about at implementing Belize's first ever centralized dispatch system for emergency dispatch. And this is one of those other areas where we can have a huge impact on people's lives because it's not just the disasters, right? When we implement a dispatch system, it's going to be valuable if and when there's a disaster, but we're impacting lives every single day with that system. Right now, we're averaging 93 calls dispatched every month. And if we start counting that against or alongside the number of people we've trained, we estimate that we're having a lives impacted metric of around 315 people a month through emergency calls and through the skills that our trained firefighters are bringing to the table. So in just a very short time that we've been operating in Belize, our metric of lives impacted, we're already up to 3,000 people, 3,000 lives impacted. So it's a huge impact that we can have for a much smaller outlay than we would have in the disaster response space. And like I said, our mission is really driven by serving others and saving lives. And this is a hugely effective way we can do it. And I guess back to your original question, now that I've strayed all the way off track, we couldn't do any of this without the partnership, right? Because it's all about working with entities and within their skill set. Trek Medics is an amazing technology platform organization, right? But implementation isn't your strong suit necessarily. We are great at training and systems building, but we know nothing about software development. So by working together, we can bring the beacon software that Trek Medics has developed, and we can be the implementation piece of that allows both of us to have a huge impact on lives saved.
Absolutely. I can attest to that. Implementation is, you got to pick your lane, right? You can't be everything to everybody. And we often meet groups that are like, yes, we need the technology, but we also need the capacity building, and we need, what's the playbook? What's the roadmap? And we could sit there and work through that with them, but that's going to pull us away from our own priorities, which is constantly improving the platform. So it is a real testament to partnership, because you guys are playing such an important role in that frankly, we always say this with we build a tool. And if you don't have people that know how to use the tool, then the tool just sits there. But at the same time, if you have all the best trained folks, and all the resources and supplies you need, but nobody can communicate with each other, especially with the people who need those resources and supplies, then you kind of have a half system, or you have a lot of equipment and supplies that just sit there, or they arrive too late. So you're absolutely right. The testament to partnership is really profound there.
And that's just it, right? So I can go down there and I can train every Belizean firefighter how to do rescue, and I can train them all in incident management and incident command. But if they don't know where the call is and they don't have a way of being told that there is a call, that training is worthless. Conversely, you could set them all up with dispatch software. You can tell them where the call is, but if they don't know what to do when they get there, it's equally worthless. And so this has been a really awesome opportunity, and you hit the nail on the head with staying in our lane. Early on as an organization, we tried to do everything, and frankly, we weren't very good at it. I took over as the executive director in 2016, and since then, one of my big goals has been to really streamline our lanes, figure out what purpose we serve, and really be really good at that thing. And so this is the outcome of that. Is we've discovered our lanes, we've gotten really good at those lanes, and we've identified partners who are good at their lanes and who we can work in parallel with. And I think the outcome is more lives saved, which is at the end of the day what we're all here to do.
Indeed, indeed. So that's a good segue to my next question. Aside from the short term of making sure your team gets to Turkey safely, does the work that they can do and does it well, and then gets back safely, what's the future hold for Empact? What are you looking to do, and where are you looking to go next? I mean, obviously, you don't necessarily know where you're going next because of the disasters. They just happen where they happen. But big picture, what does the future or the near future hold for Empact Northwest?
Well, yeah, I mean, this is such a serendipitous time to be having this conversation in so many ways, between the deployment to Turkey that's happening right now, but also since last September, our organization's been in the middle of a strategic rebuild. It was sort of the capstone to that plan I had of, figuring out where we were, figuring out our lanes, and getting really good at them. And so this capstone has sort of been this strategic rebuild that we're actually unveiling to our staff and volunteers on Saturday, 2 days from now, for your listeners who are listening later on. And we're going to be renaming and rebranding under Empact International, to better reflect the international scope of our work. And we're really going to be leaning into community preparedness and firefighter training, especially here in the Seattle area and in the Caribbean region. We're going to focus our geographic response more to the Caribbean, Central America, and the Gulf Coast of the U.S., because that's where we're able to respond very quickly. That being said, we're going to expand and I'm sorry, I should say, I'm using words a little too interchangeably here. To me, response means that early 24 to 72 hours, like we were talking about. That's the rescue, that's the medical. We're going to be adding, though, and those are the things that we're going to be focusing on: Central America, the Gulf Coast, and the Caribbean. We're going to be adding, though, a much broader relief mission to our organization. This last year, we deployed to Ukraine, and we've been engaged there for the last year in a relief mission. It's not rescue work, it's not medical work, but it's bringing the flexibility and agility and frankly audacity of our organization into a new environment. And we're going places that nobody else is willing to go in Ukraine, and we're getting supplies where they're needed, right on the front lines. And so we've recognized that there's this huge gap that can be filled by small organizations, which is sort of counterintuitive, right? Huge gap, small organization. But because we're small, flexible, and audacious, we're able to get in there to those places nobody else is willing to go. So we're going to narrow our response focus, our rescue, medical, and that first wave logistics into the Caribbean, Gulf Coast, and Central America. But we're going to broaden our relief model around the world, and we're going to add more conflict medicine or conflict relief to our mission. In addition to that, we're really leaning into the community preparedness, and we are hoping to take this Belize model and expand it throughout the Caribbean region. So there's obviously a huge need within the Caribbean, and through Belize, we've been able to really expand our footprint there and get a lot of face time with other leaders from other Caribbean nations that are taking notice of what we're doing in Belize and are interested in expanding it throughout that region. So we're hoping to take that same model of dispatch and incident management and rescue training and get it spread across the entire Caribbean region. Meanwhile, like I said, we're expanding our rescue training program here in the Seattle area. We've just done a big hire of adding, I think in the last 3 weeks, we've added 6 rescue instructors, and we're looking at doubling our courses between this year and next. We're going to be adding more advanced courses to our framework for training, and really be leaning into that more. And then a lot of this too is we're streamlining our model. I'm really excited about the idea of a social entrepreneurship venture. This is something I've been reading up on lately and kind of studying. And our structure will remain the same legally. We'll still be a nonprofit organization, but we're going to be getting out of our own way a little bit and breaking free of some of the old model of how nonprofits work. And we're going to adopt this social entrepreneurship model of using good business practices and using a business mindset to develop strong social impact and develop strong programs. It's a huge shift for our organization, but I'm really excited to see where it takes us. And I think the next 10 years are going to be even more exciting than the last 10.
Well, you got me excited just listening to it here. This is fantastic. I really applaud the evolution of your thinking here, and looking at the nonprofit model and where it works and where it doesn't and how you can improve upon it. So hats off. It's just awesome to be working with you guys. And we've had such a great relationship and look forward to keeping on that. So the last question I have is, you obviously have a lot of volunteers. So hopefully some people will be listening to this that might be interested in getting involved. How would they go about doing that?
Yeah, so if they go to empactnorthwest.org, and it's spelled EMPACT, and Northwest is spelled out. Go empactnorthwest.org/volunteer. There's an application there. I'll give everybody a heads up, though. We're not going to be actually processing volunteers probably till the end of the year. Because of this strategic rebuild, we're building a lot of foundations internally right now. And I think it would be unfair to bring volunteers in the middle of that process. So like I said, we're unveiling this new approach to our internal stakeholders here in the next over the next month, starting on Saturday. But at the end of the year, we're going to start processing volunteers again. And one of the exciting things about this rebuild is we're going to have a lot more opportunity for folks. In the past, we've really only recruited people from the Seattle area, but I think that it's changing. I think we're going to be able to recruit people from around the country and around the world here with this new model, because we're going to have a broader relief mission. In the past, we required everybody to be rescue qualified. And that requires a lot of training and a huge time commitment from our volunteer cadre. And so under this new model, I think we're going to be able to broaden ourselves out a little bit geographically and get more folks in the door, which I'm really excited about.
Very exciting. I'm very glad to be listening to this and learning about it now at the outset. Look forward to hearing more. And hopefully once your team gets back, we can do a follow-up to really hear more about their experience on the ground in Turkey and how that all went.
Yeah, that'd be great. I'd love to connect you with them when the time comes.
Awesome. We look forward to it. Thank you very much, Jake. Really appreciate all your time. It's been a pleasure, and we look forward to continuing the great work together.
Yeah, the pleasure's mine, and I'm going to make a shameless plug that you didn't ask for. We're super impressed with Trek Medics and the work you guys are doing with the Beacon program. This has really been probably one of our more fruitful partnerships in a long time, and we're really excited to see where we go together. So thank you for that, and thank you for the opportunity to talk to you and your audience today.
The pleasure is all ours. Thank you, Jake.